If you suffer with loose dentures or you are embarrassed to smile because you have missing teeth, here's how mini dental implants will change your life.
I was in a car accident and I had a fractured jaw.
I have 4 teeth missing in the back.
I couldn't hide it any longer.
I'm gonna go and get this done.
Because you don't want to go around without teeth.
Getting the mini dental implants was a life changer for me.
It looks natural, it feels natural.
It's more affordable.
Very affordable. It's well worth it.
It doesn't hurt.
What pain.
Now I can chew like real people.
I don't have to put all the goo on.
With these, I can eat everything.
I don't have to worry about being embarrassed going to a restaurant.
I wish I would have got it done a long time ago.
It's the best decision I ever made.
It hasn't made my life easier, it sure has.
Mini dental implants have changed my life.
I feel a lot more confident, my smile feels better.
They gave me my dignity back.
It's been fantastic.
It's been wonderful.
Now I have my smile back, and that's really nice.
It's just so much better.
I do smile a lot now.
My dental implant has changed my life.
I'm excited to be me again.
Well, now I don't have to worry about it. I can laugh however I want to.
I love it.
Hello, everybody, and welcome to Innovations in Health. I'm John DeSciullo, welcoming Dr. Mark Caggiano from Seattle's Best Smiles. We're going to talk about the mini dental implant. It's a procedure that's going to change your life, where you can be you again. Dr. Caggiano, welcome to the show.
Thank you, John. Thank you for having me here.
It's great to have you here to talk about the mini dental implant because it is really revolutionary. And I think the best way to start is to show maybe what a conventional implant was versus the new mini implant. You have something to explain that.
I have a model right here that shows the difference between the two. The conventional implant is a lot wider. You have to make multiple holes to get that implant in place, which adds to the discomfort of the procedure. Whereas the mini dental implant is a solid titanium implant. Make a small hole, place that in the bone, and that's how we get our stability for the process. A conventional implant has 3 parts to it, whereas a mini dental implant just basically has 2 parts, the implant and the crown.
So the conventional implants take longer, there's bone grafting, a larger hole, and while it worked for a period of time, now the mini dental implant is the revolutionary replacement for that.
The mini is just a great way to go. It's basically 5 times less. It's less invasive. It's less pain and discomfort on the procedure itself. There's less healing time, less visits to the dentist, and less cost. Everybody likes that one.
Everybody likes that one, and that's why Dr. Mark Caggiano is here from Seattle's Best Smiles. And why don't we give the address out? Got a pen and paper to write it down, everybody? It's at 13131 Northeast 85th Street, Kirkland, Washington. The phone number to call is 425-526-4215. And online at seattlesbestsmiles.com. When we look at dentures and somebody that has an upper, a lower, they're dealing with a lot of stabilization issues. They're not strong, they're not in place. The goop that you have to wear to keep that lower from moving around.
They're shifting around all the time.
Yeah. So show us an example of a lower denture and how the mini dental implant technique works.
The beauty of this, John, when I see a patient that has had dentures for a long time, in particular, most people do not get along very well with their lower denture. And so what we can do with a lower denture is place 4 mini dental implants, and inside their denture we can place these housings. And these housings have a rubber O-ring inside of them which allow the denture to be stabilized when we place it in the mouth, and that holds things in place.
It snaps right into place.
It snaps right in place. It's easy to take out. When somebody wants to clean things in the evening, in the morning, just kind of rinse around, swish around, and then you're good to go. You just snap things right back into position.
Yeah, so people who have dentures, and my mom had dentures, and I remember the struggles, and this is going back, but people still have those struggles because of the way they move around, and they have to take them out or they fall out.
The lower denture is extremely hard to keep in. You have your tongue here, there's multiple muscles that are involved with the tongue that are trying to lift it up. Basically, the only thing you have holding it in is gravity. And gravity doesn't work all that great for teeth.
I wanted my smile back like I had when I was a younger person. I had my procedure a few months ago, and it went great. No problem, I love them. I truly thought that it would be very, very painful. And I was amazed that it only took a little over an hour, and when I went home, I could basically eat everything again. Everyone notices, that I smile more, and my confidence is better now than it ever has been, and they're amazed how it changed my whole life.
So from the lower denture, now Dr. Caggiano, let's talk about the upper denture and what the mini dental implant procedure means.
Right. Many times patients will have an upper denture, and for the most part they it stays in place a lot better than the lower denture, but you still have problems associated with it. Over time, the tissues underneath it start to change around. The denture will start swishing around. You have to put goo and glue, the denture adhesive up underneath there. That creates its own set of problems. So with mini dental implants, we can attach the upper denture with more implants, 6 implants typically, and we place these same housings inside the actual denture. And this has great stability, and it can click in place just like that. And it creates not only a more solid environment for a patient, but you can also remove some of the palate and get the taste buds back and the feeling of hot liquids in the roof of your mouth or cold liquids, and just overall more comfort.
So that plastic covering is gone as a result of having the mini dental implant.
Exactly, John.
Dr. Caggiano, the fact that the mini dental implant is great is made even better with the next examples that you're going to show, and how it really elevates and brings to the patient the sense of really having a full set of teeth again.
This is like having your own teeth. I hear it all the time with patients. Within about a week or two of them having these teeth in their mouth, patients will comment to me all the time, it's like having my own teeth again. I can chew, I can talk, I feel comfortable, I can smile again. When we first give these to patients, we deliver them to patients, they smile, it brings tears to my eyes. So with both of these examples, we have what's called the grade on 8. We have more implants. It becomes very difficult to remove. As a matter of fact, you as the patient don't remove these. We call this retrievable. It has these housings inside of here. There's more implants that we place, and this is permanently seated for a patient, but we can remove it in the dental office if we need to clean around there. About every 6 months or so, we like to see patients that have these, just to take these out, clean things up, make sure everything's fitting. The next option we have, these are the number one restoration that we do in the office. It's called a roundhouse. It's that same zirconium porcelain material. We just have more implants placed, and this becomes cemented in the mouth. So once this is in, it's in for good.
And that's in place. So that's whether it's an upper or a lower or a full set.
Upper and lower, yes.
So these examples right here, folks, are as if God's going to give you a brand new set of teeth all over again.
It's exactly like getting your third set of teeth.
And you want to make sure that if you're going to get the mini dental implant, you want to talk to Dr. Caggiano and his team. If you really need this work, this is really the best that you can get.
It's a great option for patients. We love to restore people's mouths.
Now, some people who are watching may say, well, I've got some teeth in the back and I've sort of neglected them and figure it's out of sight, out of mind. But it's not, because the way you chew and the way you eat is very, very key to health. You can show us how the side teeth and even a single tooth can be helped.
Yeah, typically somebody will call, they had a bridge that's been in their mouth for 20 years. One of the teeth that holds the bridge in place is broken. Now they have a gap of 3 or 4 teeth. And for those types of patients, we can easily get them fixed up. We place 3 or 4 implants, depending on the space. Once the implants are in place, then we can then take an impression and make you a nice porcelain bridge over there. It's not only important, some people will say, well, nobody sees that area, but what it does is when you lose these back teeth, it puts so much more pressure on your front teeth that things start to splay and move out, and then it ends up causing more damage to the rest of your mouth.
And the single tooth option is important because if somebody has an accident, or it could be a young person, a sports injury,
accidents happen. You can have a root canal on a tooth that you had as a child, and then all of a sudden the tooth breaks. And the way that we restore those patients is exactly the same way. We would remove the remainder of the root, place a mini dental implant, and then make a single crown to replace and restore that area there.
And we should mention, Dr. Caggiano, this is not a tooth that you rip out of a box, shipped from anywhere. This is a made in America product designed specifically for the patient.
Right. Mini dental implants are FDA approved, they're made in America. We're finally starting to introduce them in the Northwest, and they're just a great product.
I had a lot of difficulty in eating.
But with these, I can eat everything.
It was done, done. Let's go home and eat.
I can eat steak, I can eat sandwiches.
I had dinner 45 minutes later.
I don't have any problem chewing anything.
And my teeth aren't falling out of my mouth.
This is something that is so incredible.
It's made a tremendous difference.
If you're missing teeth, I would just recommend it highly. I'd get as many as you could.
I'm very, very pleased that I have them now.
And it's important because this is something that is unique to the patient, and you do this in the office.
In the office all the time, many different situations. I encourage patients who have any questions to, give our office a call. Let's take a look. We offer free complimentary consultations to patients, and let's see what's going on and how we can help you.
And here's the number, 425-526-4215. Online, it's seattlesbestsmiles.com. 13131 Northeast 85th Street in Kirkland. Dr. Caggiano, let's get to know you a little bit. Where did you grow up and how did you get to be a dentist?
I grew up in Southern California, and I was lucky enough, on my 5 houses away from my house was my best friend, and his dad was a dentist. And his dad was a great influence on my life. He really loved what he was doing. He loved helping patients. He always seemed like he was happy to go to work. It just kind of growing up and he would take us on camping expeditions and everything. So he was a great mentor to me. And I decided at some point when I was in college that I was going to go to dental school and become a dentist.
And where did you go to school?
I went to school in Southern California, at the University of Southern California.
So how did you get from Southern California up here to Seattle?
I'd practiced dentistry for about 10 years in Southern California in Beverly Hills. And I had a young daughter, about 3-year-old daughter. And when she was about 1 or 2, I decided that this probably wouldn't be the best place to raise my kids. So I decided to figure out a place that would be better, and I chose Seattle.
We should mention, folks, Dr. Caggiano is accredited in so many ways. In fact, the list on your resume is really quite impressive. The International Dental Implant Association and the Dental Organization of Conscious Sedation. We'll start, obviously, with the implants. You know, if we're going to get a mini dental implant, there's nobody else to see. You are the mini dental implant expert here.
We're the Mini Dental
Seattle.
Implant Center of America in Seattle.
Yeah.
We're the place to go.
That's number one, but the Dental Organization for Conscious Sedation is important because people need that sedation dentistry to get them over the hump.
I've been doing sedation dentistry, and most of you have heard me on the radio, the sedation dentist in Seattle, Dr. Mark A. Caggiano. I've been doing sedation, and it's just been a great bonus to patients. We can basically get you to comfort level where you're completely relaxed, totally comfortable, and you're kind of just dreaming the appointment away with our oral conscious sedation. We offer free conscious sedation for all of our mini dental implant patients if they would like it.
And with that, the laser dentistry. How important is laser and technology in working with your patients?
Well, laser dentistry really helps us out. We can use it for periodontal disease. We can use it on our veneer cases. If we have to change the gum line, we can reduce some of the gummy smile patients have. It helps us out in implant dentistry, to helping uncover implants. It works in numerous ways in dentistry.
And that technology is something, I mean, you've been a dentist for a little while now, all over. It's advanced so much. And I know that you have what's called a cone beam in your office. It sounds like something from outer space, but that's able to give a 3D imagery.
Yeah, we do. In our Kirkland office, we do have the cone beam X-ray, which gives us a 3-dimensional picture of all the structures inside of your mouth.
And I know that you keep up with the technology. You go cross country to see Dr. Todd Shatkin.
In Buffalo, New York. He's the guru of mini dental implants. And there's a whole network of us dentists that travel out there 3-4 times a year to re-educate ourselves. We're always learning.
Yeah, and you bring that technology and that information right back here to
Seattle.
Restoration. Let's talk a little bit about that.
Well, you know, if we have lots of patients over the years that we've helped fix their mouth up. It's not just fixing their mouth up, but it's making their mouth look more aesthetic. One of the primary things that I decided years ago was to try and get metal out of patients' mouths. All of our crowns and bridges, they are all porcelain. Similar type of thing as we have in our zirconium products for implant patients.
And with the full mouth reconstruction, this is something where you would work with the patient on the process of that.
And it can be with your own natural dentition, or it can be without your teeth and doing mini dental implants to fix things, to get them back to normal.
And you do the smile makeover.
We love doing smile makeovers. It's also one of the most rewarding things when we can change crowded, crooked, rotated teeth, worn teeth, dark teeth, basically get your smile to how it looked when you were 22, 25 years old.
Well, and Seattle's a pretty progressive place. I mean,
very progressive.
We all want to be on the cutting edge. We are on the cutting edge here in so many ways with technology and the industries that are based here. And this is a way to be on the cutting edge with your look, with how you are perceived.
You know, the smile is the kind of the window to your heart, I guess. People who have this work done, they're always talking about how much more confidence they have. You know, men, I've seen tons of men over the years that have grown mustaches over their mouth to hide their smile. Women who talk, when they're talking, they talk with their hand over their mouth.
Getting the mini dental implants was a life changer for me.
Not a second thought about it. I would do it again. This is something that is so incredible.
I feel a lot more confident, my smile feels better.
And it brought a lot of confidence back to me.
I feel like I do have more confidence than I did before.
Totally pleasantly surprised at this whole dental experience here.
Getting those teeth fixed just increases self-confidence immeasurably.
It's important, and whether it's in a relationship or a job or just that sense, I've had dental work done, I can't tell you, you really feel better about yourself. You just do. Yeah. When you have a consultation, you mentioned it's a free consultation, I'm sure that cost comes up, and there's a cost for everything. And we're used to buying things on time. You know, we buy our car, we pay for it monthly, we buy a major appliance, we pay for it with a credit card. But you are able to work with the patient so that the experience is worked out, so you can make sure that your patients are okay.
Right. If a patient wants our procedures done, we're going to help you try and figure out a way to do it. We work with a couple of great companies that do financing. We really strive to get patients what they want and what they need. It's a great experience.
This was really affordable.
I would definitely recommend mini dental implants to everyone.
Very happy with it. It looks natural, it feels natural.
I wish I would have got it done a long time ago.
It's the best decision I ever made, so it's well worth it.
And the mini dental implant is less than the conventional implants that we saw earlier.
A lot less.
Let's mention that again. It's less invasive, less pain and discomfort, less healing time, less visits to the dentist. Not that we don't want to see you, Dr. Mark Caggiano.
It's understandable.
But, and it's less expensive. And it's something where there's no embarrassment, you know, no matter what your age. You know, dentures we associate with some of the people who are a little older. But the mini dental implant, if someone's out there watching saying, well, they just talked about dentures, and that, no, it's for you too.
Right. One of the biggest advantages for mini dental implants is that it takes a lot less bone. I've worked with a number of patients that have said, well, I went to get a consult for an implant, but I don't have enough bone. They said they want to do major grafting and all these surgeries to get things to work. But most times with mini dental implants, we can find that bone because we don't need as much bone to place those implants.
And we should mention that titanium post, the bone kind of grows around it. Osteogeneration. Integration,
yeah. Well, the advantage of the mini, it works in two ways. We're getting a primary stability or holding into the bone by the threads that are on the implant, number one, and then the body's own osseointegration, or the actual bone cells growing onto the implant and forming a connection to your bone, is the second way that holds the implant in place.
So if you want to go see Dr. Mark Caggiano, you get the free consultation, Seattle's best smiles. Remember, you can be you again. The mini dental implant and Dr. Caggiano will change your life. And it's just a phone call away at 425-526-4215. The office in Kirkland is at 13131 Northeast 85th Street. You're near the Costco, the Kirkland Costco.
Kirkland Costco, we're about a half a mile away from that. That's the landmark I tell everybody. Everybody knows about Costco.
Yeah, of course we do. Yeah, and there you are, right near it. So with all the cosmetic work that you've done, I have to talk to you about some of your patients. And you have online some amazing testimonials. What do people say to you when they get the mini dental implant procedure? What's their reaction?
The reaction is usually, I can't believe I have a tooth there now, or I have teeth that I can actually smile and chew with.
I want to read some of them off of your website. I tell everyone to come here. Dr. Caggiano also saw my 4-year-old daughter, and her first experience was perfect. Now that's tough to get.
I know, it's not easy.
Yeah, not easy with little ones. Here's another one. Everything has gone great, and everybody is really nice. Working at the Space Needle, I was always self-conscious about smiling. And there he is at a very prominent landmark.
Right, sees thousands of people a day.
Yeah, now my smile has been restored and my confidence. James writes, I am grateful Dr. Caggiano has restored my trust and confidence in dental experiences. I'm no longer afraid to have the work done.
Oral conscious sedation.
Yeah, very important. Yeah. How long have you been talking to people on the radio here in Seattle?
Probably close to 20 years. I started doing oral conscious sedation, or as my tagline is, the sedation dentist in Seattle.
Well, it's worked because some of the other testimonials, I'm happy with the sedation dentistry, Ann writes, and anything that needs to happen can. I don't remember a thing. So
that's the best part about a dental appointment. Yeah. If you can't remember it, it was a good appointment.
So those past experiences, you say sometimes, are the reason people don't go to the dentist.
You know, I've heard so many stories over the years of talking to patients and them pouring out their hearts to me about experiences that they've had, whether I've had patients tell me that the dentist used to kind of smack them around or hurt them when they were younger. Patients that the dentist never gave them any anesthetic when they were younger. I have patients over the years as adults with bad experiences. And some people just, to be honest with you, are born with bad teeth. And they have to go through this litany of dental procedures over the years, and then they finally spent all this money and they're wondering, why don't they have teeth that they can smile with? Why don't they have teeth they can chew with? That's where the mini dental implants come into play. We can get you teeth, we can get rid of your broken down, infected teeth, get things to heal, place the mini dental implants, get you something permanent or removable so you can smile, chew, and be you. Let you be you again.
Let you be you again. And if you're making that investment, you want to do it in a way that you're not going to keep going back.
Right.
So let's do it right.
Right.
Do it right, and there it is. And with that, I'm going to go back to the models again, because if you've been watching us for the whole half hour, then you know what we've been talking about, the mini dental implant. If you just joined us and you're halfway through the show and you're thinking, what's going on? Well, this is Dr. Mark Caggiano from Seattle's Best Smiles. You've heard him on the radio for years here in Seattle. But we're talking about the mini dental implant. This is an example, a conventional implant. See the difference there?
Yeah, the conventional implant is a two-piece implant, which actually becomes a third piece, and it's just a wider implant. So you have to drill multiple holes for that. With a mini dental implant, you basically make one small pilot hole in the bone, and then you thread this implant in place, and it's a solid core titanium implant, where this is a hollow core titanium implant.
This is an example of a lower denture. So the stabilization, very important in a lower.
Lower denture, as I explained earlier, patients have had lower dentures. They're flopping around all the time. They can't chew. They can't put any pressure. They usually come to me as a last resort. And for these type of patients, we can place 4 mini dental implants, attach these housings into their denture, and then now they have something that will snap in. They still have to remove it to clean it, but you have something where you can put pressure and you can chew.
Yeah, so again, that lower that moves all around and all the goop is gone.
No longer do you have to rely on gravity keeping your teeth in.
Now I know that you are a great cook.
I love to cook.
You love to cook, and I've read somewhere that pizza is one of the best things that you make.
Well, I've been told that by a number of people. We like to entertain, my wife and I, and we like to source our food as local as possible. And years ago, I started trying to make pizza, and I'm still practicing. But 20 years later, things are pretty darn good.
Yeah. So there's always that, Dr. Caggiano. And the reason I bring up food is because you want to taste whatever you're eating and get the full impact of all of the great flavors. Tell us how the palate is returned with the upper denture.
Yeah, so with this upper denture, if it's implant retained, we can get rid of some of the palate over there. So you can taste food again, you can taste the temperature of foods. And this thing here, as you can see, by just adding a couple more implants, is very nicely retained. Still has to be removed to be cleaned, but at least you've got multiple implants and multiple housings.
And it snaps right into place, and that palate is back. Dr. Caggiano, in addition to what you just showed us, I'm going to give you the model that we looked at earlier. So if somebody has some back teeth that need to be repaired or a single tooth, the mini dental implant can make a big difference.
It certainly can. Previously, most times when somebody's missing teeth like this, they had a large span bridge, one of the teeth broke. They don't want to do another bridge because typically that same thing is going to happen. We'll remove the tooth that's missing, place mini dental implants, and then we can make a permanent fixed bridge to replace those teeth.
And that's important because you want to eat healthy, and that tooth in the back, the teeth in the back, are what chews the food.
Well, it's not only chewing, but these back teeth are the foundation for the mouth. You lose back teeth, and then you start to lose the mobility or shifting of the front teeth.
And then a single tooth option in case somebody has an accident.
Accidents happen all the time, and with mini dental implants, we can simply remove the broken tooth, place a mini dental implant, and then make a single crown and cement that in place so everything is permanent.
But the mini dental implant, folks, gets better. These are the next 2 examples I'm going to give to you. The models there, Dr. Caggiano, you can show us and explain why this is the ultimate. If you're going to get a mini dental implant and you're going to do this, folks, this is what you really need to do.
These are just like your own natural teeth. The shape, the size, there's no extra material covering any part of your mouth. We just have the implants underneath there. This particular one is retrievable, so we in the dental office can remove this at your regular cleanings just to clean up underneath here. It's got these O-ring housings in there which snap in place and do not come out very easily. Trust me, this model is made so it can come out sort of easily, but you can't get it out of your mouth. The other option, which is the premium restoration we have, is we call this the roundhouse. And basically, there's multiple implants, usually 10 to 12 implants. Once this bridge is placed, it's that zirconium bridge we talked about. It's all porcelain, cemented in place. It does not come out. It's solid. You can, I had one patient say, gee, I feel like I can cut a tree down with my teeth. I would not highly recommend that.
No, let's not go there.
But he did say that.
So this is the, the grade on 8 and the roundhouse. Those are as if a brand new set of teeth has just been given to you. Yeah.
Yep.
And when we talk about pain, we talk about the less healing time. An ibuprofen is something that you would prescribe almost just for an overnight.
Right. For the implant surgeries, 2 Advil, 2 Tylenol is what we recommend for patients. And I have patients that talk about having very little pain, if any.
It was totally painless.
What pain? I had no pain.
I didn't have any pain.
It didn't hurt.
I never felt a thing.
There was no pain, no discomfort whatsoever.
One trip, it's great.
One visit, you're done.
Less trips, the better.
It's actually really painless, and I wish I would have got it done a long time ago.
So I did it, and I'm very happy with it.
I left again with a tooth that day. I took 1 Aleve that evening, and that was it. Yesterday, I had 4 implants put in here. I took 3 Aleve, and that was it. And today, it's just a little sensitive if I touch it, but I have teeth there now. It looks good.
It was good.
And you mentioned a water pick for cleaning and convenience. That's once again, it's something you'd buy over the counter.
We give our patients, when we do a roundhouse or a grade on 8, water pick. It's the easiest thing to use. You're basically just cleaning around where the bridge is. That's the maintenance that's required on these.
We're talking about the mini dental implant with Dr. Mark Caggiano, and here it is, Seattle's best smiles. It's the best because you got the best right here.
Right here.
13131 Northeast 85th Street in Kirkland. And the phone number is 425-526-4215. Write it down. Don't lose it. Call right after the program. 425-526-4215. And online at seattlesbestsmiles.com. And before we wrap up, Dr. Caggiano, what does it mean to you to be a dentist, to help people?
Well, over the years, when I see a patient that has been compromised in a number of ways, missing teeth, painful teeth, initially when you see someone and you say, how you doing today, most patients will give some kind of sarcastic remark saying, terrible, I'm at the dentist. I've heard that thousands of times, right? And so I feel it's kind of my job is to spend time with patients and to get them to understand that, first of all, I tell them I'm here to help you, number one, and the types of dentistry that I do for patients is the same thing that I'd want for myself and my family. And when we talk about dental sedation and we talk about how we can get most of this stuff done in as minimal amount of time for patients, they start to come around and feel more comfortable with what we had to say. And it's kind of just guiding patients through whatever process they need to get them to the stage where they don't have to go to the dental office. And I think getting patients healthy and reducing the amount of time that they have to stay in the dental office is really the number one thing that I can do for people.
Well, you're doing a great job. You're doing a great service to all of us here. And you are an innovator in health. We appreciate you being on the program. And thank you and good luck to you. And next time, cheese and pepperoni, okay?
There you go.
There you go. All right,
I'll make a note.
There you go. Dr. Mark Caggiano, thanks for joining us and thanks for watching Innovations in Health.